Everyone. We'll certainly have additional people coming in shortly. It's the second morning. It's always a little bit slower. But we have a really full program for you today. We're super excited to have the opportunity as the Iodine Global Network to be presenting at the World Salt Symposium. Of course, we are a different cohort and stakeholder involved with the salt as an important tool, but we have a really important success story to talk about, and that is how salt has been used as a vehicle for the delivery of iodine. And yesterday we heard a lot about the debates around salt reduction and the controversy around whether salt is healthy or not healthy at different levels. What we're here to talk about is the fact that salt as an individual condiment has been used as a way to basically protect the brains of unborn children. We have a program that we've developed. The first few presentations this morning will be, first of all, myself providing a global overview of the successes around universal salt iodization, the role of the salt sector in the salt industry. That will be followed up by two salt producers, one from Brazil and the other based in the UK and Nigeria, to talk about the role of the salt industry in contributing towards universal salt iodization. And then we'll hear from Noor Khan, who is with Nutrition International. And Noor will be speaking about a really important shift in the way that salt iodization programs are being implemented in many developing countries, and that is around the consolidation of the salt industry. So rather than focusing on small-scale artisanal farmers, we're trying to encourage formations of cooperatives and collective action in order to allow salt production and salt iodization to be more efficient and effective. We'll break for about 15 minutes, and then we'll come back for a second session that will begin with Katia Diaz from Mozambique, who will be talking about two very critical elements of salt production and salt iodization programs, which relate to regulatory monitoring and the procurement of potassium iodate and making that process of premix procurement more efficient and effective. That will be followed by Robin Houston, who will speak about what we see as being a very critical shift in the overall paradigm of salt iodization. And that is that rather than focusing on household salt to be the exclusive salt for iodization, to try to encourage the use of iodized salt in processed foods and condiments, something that we're working very hard on doing. I'll then come back and speak about a new initiative that's being undertaken in India and a few other countries that expands the use of salt as a vehicle for fortification from just iodine to including iron and possibly other nutrients. And then we'll have a small panel discussion amongst a number of salt producers, and we hope that you guys can contribute as well to talk about your experiences, some of the successes, some of the bottlenecks and challenges, so that we can really think about how we can move with this changing landscape forward. With that, I just want to speak real quickly about the Iodine Global Network. I'm the executive director. We are a global organization, and essentially we are a network of partners working towards the elimination of iodine deficiency disorders. We are the leading scientific organization undertaking research, operational research around iodine nutrition, as well as salt iodization. And we are also made up of governments, salt producers, civil society, and development partners. We are, in fact, the collective inputs that are provided from all partners working on salt iodization. And we try to encourage harmonization so that the work that's being done globally, regionally, and in individual countries is done in a uniform and a standardized manner. So with that, I'll go ahead and shift over. I'm actually presenting this initial slide deck on behalf of Roland Kupka, who is the UNICEF Senior Micronutrients Advisor, who was not able to be here today because of a family emergency. Roland Kupka at UNICEF has worked for years on salt iodization. Initially, he was based in West Africa, and since joining UNICEF at headquarters, has really pushed ahead and continued the work that UNICEF has been doing. As we heard from Stan Soderstrom yesterday, UNICEF has been a leading partner in the fight against iodine deficiency disorders, and was really the primary public health agency involved with supporting salt iodization programs in the early 1990s. I actually get to move these. So I'll talk a bit about iodine just to place the context of what we're doing, background about salt iodization programs, and a little bit of the major national and international meetings that sort of set the stage for salt iodization programs. Then I'm going to present to you the most recent data on iodized salt coverage at the household level. I think if you don't know these data, they'll be hopefully very exciting and important for you to realize the tremendous progress that's been achieved. I'll then speak about how that increased coverage of salt iodization has translated into improved iodine nutrition at the country level. We have global maps that we'll share with you dating back to 1993. And then I'm going to talk just briefly about some trends in our programmatic work and some of the way that our work has sort of evolved as salt iodization programs have matured and as the landscape has shifted, particularly around salt consumption patterns. And then I'll wrap up with a few concluding slides. So as a lot of you probably know, 90% of neurological development, brain development, happens before a child is 5 years of age. What we know, this is a complicated graph, but the left side of the graph represents the first 1,000 days from conception through pregnancy and the first 2 years of life. And you can just see the dramatic activity that takes place in terms of the development of the hypothyroid, pituitary, and thyroid axis. This is where most of the brain development happens. And of course, iodine plays a critical role in the formation of a number of these different systems and structures. The absence of iodine can lead to permanent brain damage. Severe iodine deficiency early in pregnancy can lead to irreversible brain damage, including cretinism. So iodine is really critical. The importance of iodine is perhaps most profound in the first few weeks of gestation, and that's why salt iodization is such an important intervention. By the time a woman becomes pregnant, knows that she's pregnant, if she's provided with an iodine supplement, it's often too late to really have an impact to be able to have an effect on the neurological development of her child. Iodine is important in the development of different thyroid hormones. It's critical for brain development, and we've often seen this goiter and enlargement of the thyroid gland as an adaptation to suboptimal iodine nutrition. The point of it is that in the absence of enough iodine, severe mental retardation and cretinism was widespread on the planet not only 40, 50 years ago. So we've seen tremendous progress. Salt iodization is the most cost-effective and recognized intervention to be able to improve the supply and availability of iodine to the diet. This is a complicated slide, but suffice to say that between 1990 and 2007, there have been a number of global meetings which recognize the importance of iodine deficiency and the need to eliminate and to ameliorate iodine deficiency. Initially, iodine deficiency was addressed through supplements, but after 1994, salt iodization programs really ramped up and became the primary modality through which countries were able to improve iodine nutrition in populations. We heard yesterday from Kiwanis about the tremendous contribution that they've provided through UNICEF and other agencies to be able to work with countries to establish national plans of action, to establish a salt industry, to be able to produce iodized salt. And over the last 15, 20 years, we've seen tremendous progress in the establishment of mandatory salt iodization and its implementation in countries all over the world. 108 countries in the world currently have mandatory salt iodization. Over 130 countries have programs where salt iodization is in place, some on a voluntary basis. The World Health Organization recognizes that the fortification of salt with iodine is an incredibly efficacious and important intervention. WHO recommends that all food-grade salt be iodized with a minimum amount of iodine to meet physiological requirements. What's really important is that the recommendation extends to all food-grade salt, which means not only the discretionary salt that's consumed in households, that's purchased, brought home, used in cooking, and used as a flavoring, but all salt that's used in the food industry in the production of manufactured products, including processed foods and condiments. This is a part of the paradigm of universal salt iodization programs, which is changing, and we'll speak to that later in the program. As you know, WHO does also have a policy that there is a compatibility between their focus on salt reduction and the use of salt as a vehicle for iodization and improvement of iodine status. We in the Iodine Global Network recognize that these strategies are compatible. If there are in fact reductions in salt in populations, we're able to increase the concentration of iodine in that salt in order to be able to meet the iodine physiological requirements. So we do track changes in salt consumption patterns in accordance with the WHO recommendation. So these are the data right now. 86% of households in low and middle income countries currently have access to salt which has been iodized. It's a tremendous, tremendous metric. You know, for UNICEF, which tracks these data, we are often challenged with being able to reach high levels of public health significance in terms of our main interventions. But the reality of it is that across regions of the world, you can see here, both in Eastern and Southern Africa, Western Africa, South Asia, and in the Pacific region, that the penetration and the coverage and the reach of iodized salt has been nothing less than dramatic. And globally now, we estimate that 86% of households do have access to salt with some iodine in it. This gives you an idea of the distribution. There are a few countries, including Somalia, where the coverage remains quite low. But the light purple and the darker purple is a reflection of where salt iodization coverage has been able to reach reasonably high levels at the household level. Having enough iodine in iodized salt means that people are meeting their physiological requirements for iodine, and their iodine status is improving. When we look at the iodine status of populations, we're able to assess whether or not a population is consuming enough iodine to prevent deficiency. The Iodine Global Network has been tracking the prevalence and the status of iodine status in countries since 1993. In 1993, 113 countries were classified as being deficient, with varying degrees of deficiency. The depth of the purple is a reflection of the severity of the problem. In 2003, that number had basically halved. This is the period where salt iodization programs were really ramping up, and the iodine supply to populations had been dramatically increased and improved. A few years later, there was a further reduction in terms of the numbers classified with iodine deficiency. By 2012, not only did we continue to see a decline in the number of countries classified with deficiency, but we began to see a few countries emerge with excess of iodine in the population, which was indicative or reflection of the fact that salt iodine levels were a bit too high and required adjustments. And what we really did in 2012 was we focused not only on the elimination of iodine deficiency, but the achievement of optimal iodine nutrition, which is to say, make sure that there's enough iodine in the diet, but don't impose too much iodine so as to increase the risk of excessive intake. This is our current situation right now. The Iodine Global Network database currently classifies 19 countries as continuing to be deficient. What's striking about that is that a few of those are in Western Europe, as well as parts of Southern and Western Africa. A lot of our work is focused on these 19 deficient countries to ramp up and to accelerate the establishment of salt iodization programs, as well as to make sure that we're sustaining the progress that's been achieved in other countries. This is just a map that we were able to produce for a micronutrient forum meeting 2 years ago, which just shows the tremendous change that took place in the Americas between the 1950s, when many regions of both North and South America were classified as being endemic for goiter, and by 2016, where all countries were classified as having optimal iodine intake, with the sole exception of some areas being classified with potentially excessive iodine intake, requiring adjustments in their programs. Another way to look at these data is to think about the impact of improved iodine nutrition on goiter, a physical manifestation of iodine deficiency. What these two graphs show you is the number of countries that were classified as iodine deficiency and the prevalence of the population with goiter, or physical enlargement of the thyroid gland. And as you can see here, 113 countries, the colors representing different regions of the world, the size of the bubbles reflective of the population, were classified with deficiency. And then in the current situation right now, what you see is the dramatic shift of entire populations, both in terms of, I'm going to try to go back, both in terms of the level of iodine in the urine as a reflection of iodine intake, but also a reduction in goiter. So salt iodization has had a tremendous impact on populations, physiologically, and certainly it has an effect on their social and their economic development as well. What we do find is that there are certain regions of the world that continue to struggle with achieving optimal iodine intake. Perhaps the region where we are most challenged by right now is in Western and Central Europe. A lot of those countries do not have mandatory salt iodization. We work with EU Salt, a key partner of the Salt Institute, to try to develop innovative programs and policies to be able to make changes that will make a difference in those countries. So I wanted to talk just real quickly about some outstanding programmatic issues in some areas where the Iodine Global Network has been shifting its attention. One of the things that we feel is really important is to continue to track changes in population iodine status. But we know that even within countries where as an aggregate things are going well, there are subgroups within the population who are not able to access iodized salt and be fully protected. So achieving equity and making sure that all groups are fully protected is an extremely important ambition of the work that we do. The third bullet is really important, and Robin Houston will speak to this more later this morning, and that is that while the definition of universal salt iodization designates that all salt, including the salt used in the food industry, is iodized, that has programmatically not taken place in most countries. And we've been encouraging and promoting the use of iodized salt in bread, in noodles, in condiments, including bouillon and soup powders, as much as possible. So understanding the sources of salt in the diet, whether that salt is iodized, and encouraging a better, more holistic approach to salt iodization is the critical next frontier for the work that we're doing with national programs. We know that we need to work together with governments because as soon as there's the perception that things have been achieved, that some high level has been reached, then governments shift their attention to other public health focus areas and other priority areas. So working with governments to prevent backsliding, to make sure that there's a strong commitment, including imposition of regulatory monitoring, which Katya Das will speak to later this morning as well, will be really important. We also know that we can't continue to operate in a vacuum. Salt iodization and iodine is important, but it's part of a much broader development and nutrition agenda. So integrating iodine fortification into other fortification programs, identifying opportunities for better synergy has become incredibly important moving forward in order to sustain the progress that we've achieved. And then finally, we are aware of salt reduction efforts, and to the extent that we can collaborate together with those efforts to make sure that we are aware of where salt consumption patterns are and to make commensurate changes in iodine content so that the minimum requirement of iodine can be reached continues to be important. So it's unequivocal that salt iodization has really been one of the biggest public health success stories of the latter part of the 20th century and as we move into the 21st century. We're super excited about the progress that's been achieved, and it wouldn't have been done without the salt industry. We come here humbled because we know that our contribution has been relatively minimal compared to the contribution of salt producers. And we're just incredibly thrilled and honored to be able to collaborate together with salt producers. There's still countries that we have to work in and focus on. We prioritize our work in those 19 high-burden countries, and we try to integrate the work of salt iodization and IDD elimination into the broader nutrition and development agenda. So with that, I'll go ahead and just close. I'm going to now introduce Luis Caetano, who is a salt producer from Brazil, who will speak to you from the perspective of a salt producer, what his experience has been like in Brazil, and both positive and negative views of that. And then we'll continue with the program from there. Thank you very much.
Good morning. Glad to see you all. I have been involved in the salt industry for over 34 years. Our industry manufactures food-grade refined salt and has the leading brand market. I am also an IGN board member. Micronutrient deficiency represents the most widespread form of global malnutrition. About 2 billion people, including 241 million school-age children, nearly one-third of world's population, do not have an adequate intake of iodine. Brazil is the largest country in Latin America by geographic size, economy, and population, with over 200 million people. Iodized salt has been available in Brazil for more than 60 years and has virtually eliminated IDD from the country. However, the IDD program faces new challenges, including possible mild iodine deficiency in pregnant women and harmonization with salt intake reduction efforts. Researchers and experts have devoted more attention to identifying the effects of proper iodine nutrition on the most vulnerable groups, pregnant and neonatal patients, up to the first 1,000 days of pregnancy, long-term damage. In Brazil, the Ministry of Health recommends the iodization of all salt intended for human consumption, ensuring the legal, administrative, and operational conditions for the systematic application of the measure in the partnership with the Coalition Committee, stakeholders, and the salt sector. This concern with the salt iodization in Brazil is a very large way of controlling iodine-deficient disorders. It's quite old and began in the early 50s with a federal law which made it mandatory for iodination of human consumption salt. These measures allowed a considerable advance in the control of IDDs in Brazil. Since the establishment of obligation to add iodine to salt in the 50s, the Ministry of Health conducted 5 surveys to evaluate the impact of the intervention in Brazil. The results show of significant reduction of goiter prevalences. Okay. Over this period, through laws, decrees, resolutions, and ordinances, health authorities have perfected and adapted legislation in response to research and technological advances in order to pursue the established goals. An ordinance of February '84, the Minister of Health established an appropriator for human consumption of the salt with the dosage of 10 to 30 ppm, and also decided to provide potassium iodate free of charge to the salt mills. But the industry would have to agree to a system to close surveillance, whereby samples of salt would be periodically tested both on the wholesale market and on the production lines. Also, on the another ordinance of the authorities were determined a basic procedure for GMP, a good manufacturing practice for salt production for human consumption, and all facilities have been visited and oriented in the deployment. In spite of this considerable and exemplary advance in the control of IDD in Brazil, the need to improve prevention and control actions led the Minister of Health to establish in 2005 the National Program for the Prevention and Control of Iodine Disorders, which through the partners of the Interinstitutional Commission, a coalition committee, is constantly monitoring the iodine supply of the population, which is a key element in preventing resource of the serious public health. The program has 5 basic lines of action: monitoring the iodine content of the salt for human consumption, monitoring the impact of the salt iodization on population health, updated legal parameters of the iodine content of the salt to human consumption, and continuous implementation of information, education, communication, and social mobilization strategies. The process indicator of this program is that 95% of the salt intended for human consumption must be iodized by the establishment according to the national standards of iodine content. A national survey that we call the National Research for Impact Assessment of Salt Iodation with urinary excretion of iodine being made the indicator to be measured in 18 states of the Federation plus the Federal District, covering 477 municipalities with a universe of 19,000 school children from age 6 to 14 years of age. Also, a total of 3,600 samples of salt, cooking salt were collected. Results show that a current median urinary excretion of iodine for school children aged 6 to 14 years is greater than 100 micrograms per liter. The median was below the cutoff point of deficiency in no federation or federal district unit. The World Health Organization recommends that less than 50% of the population present levels of iodine below 100 micrograms per liter, and then less than 20% levels of iodine below 50 micrograms. And that's the distribution of this survey. That's the whole country. And then comes the South, the Midwest, the Northeastern, and the north of Brazil. Brazilian salt industry, a first-time partner of the country's health and sanitary authorities, is the operational arm of the Pro-Iodo and responsible for the addition of iodine to all salt for human consumption. To that end, it actively participates in the Interinstitutional Commission, the Coalition Commission, updates itself in international events, and we have a seat at the IGN board. The industry investment in inputs to meet the goals of Pro-Iodo is in the order of $2 million a year, and this is the real support in the success of Brazil's largest public health program. The strategic approach of Brazilian Association of Food Industries and the Ministry of Health in a partnership for the voluntary reduction of sodium toward the health and nutrition program has given results. So far, 4 commitment terms has been signed for sodium reduction with goals established to withdraw tons of sodium by 2020 in 35 food categories and reached 9.3% of the target so far. Strategies of this high relevance in terms of public health can be implemented through alliances and joint efforts of salt companies, public power, and other partnerships. Depends on the secure convergence of the stakeholders and commitment to better meet the needs and demands of the society. And this is quite important, the success factor for IDD prevention, and coupled with a National Health Life Program is a coalition, a commitment between stakeholders, support by political will, and a strong regulatory legislation with penalties for violations. Now I would like to call up here and introduce Rich, which will bring us some challenges in Africa. I think it's yours.
You just press this? Yeah, okay. Hi, good morning, everyone. My name's Rishi Kansagra. As you can hear from my accent, I'm based in London, but I'm going to be speaking from an African perspective. We've, as a family and as a company, been in many countries in Africa over the last 30 years in the salt industry. I think we've seen a lot of interesting things, and I'd just like to share some of these perspectives with you on a more anecdotal basis. Africa's a very, and I'm a recent member of the IGN board, getting to know what they're doing and working and engaging with them more proactively. Africa's a very heterogeneous environment. I think it's very difficult to come and stand in front of you and say that I can tell you the broad trend of what's happened in Africa, or the direction it's taken, because there's so many countries, so many different environments, and things vary so much from country to country. So I'll try and take you through 3 cases that I know relatively well. One where I think things have gone very well, one where there have been some wins and losses, and one where things haven't worked out how we would have wanted after some time. Personally, I would just like to say that I think that it's been a very humbling experience for me and for my company to have been part of this journey. Since we started engaging with IDD as it was in those days, it was, it's amazing to see the impact that a company can have. And whilst you can continue to hold the values of your shareholders, increase the value for your shareholders, you can also make tremendous changes which have huge impacts on countries. And I think that for us, and I hope for all salt producers, as we try and spread this story, they'll be able to engage and learn and see that those 2 things can come hand in hand. I think that regulatory standards throughout Africa have varied a lot, but more critically, enforcement standards of those regulatory standards have been very inconsistent, both from country to country and also within countries over time. And that has led to a lot of variability in what's happening in salt iodization, although positively, with a positive trend as things have improved. Some parts of Africa, you'd be quite surprised to see the understanding and importance that the general population give to iodine, and understanding the role that it's played. Some governments over the course of the last 20, 30 years have continued to engage with UNICEF, IDD, and now IGN, and you can see the tremendous strength in the population itself and the understanding of what's good for pregnant women particularly, and children. But in some you can't. And as I say, all in all, it's very difficult to generalize. I'll start with the kind of the good end. You've got somewhere like Kenya, which has always had historically very strong regulatory enforcement environment. Consumer understanding has built up. It's been a textbook case in so many ways of how you want to do it. And as you see John's maps, somewhere like Kenya or that part of East Africa would never be part of where you'd see the kind of deficiencies and shortages in salt iodization. From the 1970s onwards, there was a switch from kind of a consolidated set of small producers towards iodized salt. And I think that has maintained, both because of enforcement, but also because customers understand and have no will or desire to go back to uniodized salt sold in a bulk environment. It's close to 100% availability and coverage of iodized salt, and over 95% coverage since 2000. Nigeria has had a much more kind of volatile history. This is kind of where we learned, and I think our company particularly was part of this story that led to 2005 Universal Salt Iodization Certification, which I think was a huge win for Nigeria and had taken them on a very rapid trajectory to a very positive story. And it was humbling to see what could be done and to see what assistance from outside could do to bring such changes. In particular, rather than the salt producers, who I think were cooperative and played their part, I think what I learned personally was the role of what was then NAFDAC, it still is, National Agency for Food Development, Administration and Control, the regulatory authority, with strong leadership and kind of ambassadors in there almost from the Iodine Global Network. You could see the strength, the determination, and what it led. And it was incredible, because it only took a few years to do this. But as you see in these kind of cases as well, from 2005 to 2008, the political changes led to a lot of changes within the senior ranks of NAFDAC, and it was amazing to see how quickly that whittled away. The regulatory environment remained exactly the same. The rules today remain exactly the same, but enforcement of those has faded. By 2008, it was amazing to go from 3 years from 100% universal salt iodization to 52% of households consuming adequately iodized salt. Ghana comes from a different perspective again, because it's a highly fragmented salt industry with a lot of small-scale producers. Now, I think a change, I don't want to steal the team's thunder for later in the presentations, but I think one thing that large producers have to learn and understand is that the role of what the IGN is trying to do has changed a lot. My initial understanding as a salt producer, and not coming from this world, you know, of NGOs and this general culture, was that IGN and ICC, IDD before them were people that kind of helped small-scale producers with backpacks, you know, of iodization, and we were cynical towards it and felt that it wasn't particularly it wasn't particularly sustainable, and I think as a result there was an attitude from producers that we wouldn't be able to push this forward. In Ghana, unfortunately, this kind of thing hasn't worked as well. Consumers don't understand. Regulatory environment is weak. Enforcement has been weak. There has been tremendous efforts made, but consumption of locally produced non-iodized salt is still extremely prevalent, and there's a lot of misinformation in these kind of markets. There's a lot of people, anecdotally I can say, who feel that, you know, iodized salt could be dangerous, or, you know, it should not be consumed. However, and again, not to steal the next session's thunder, you've got to draw a distinction between salt iodization and iodization prevalence in the general public. And because of a shift towards manufactured foods, and in particular consumption of bouillon, recent studies have shown that the iodine status of the population is adequate, which has still been a big win for the Iodine Global Network. So, I don't know, I mean, what lessons can we draw? What can we learn from Africa? I think it's very challenging to be able to draw any specific lesson. I think we've learned that some things were not being done well, some things were. IGN is working on different concepts, smart concepts, in Ethiopia, which I'll touch on later, to consolidate the salt industry, where central refiners will purchase from small-scale producers, because small-scale producers will continue to remain a key part of a lot of these a lot of the infrastructure of what's going on in these small countries, and you can't change that. They're continuing to work and engage with government on regulation enforcement, and now engaging with food manufacturers as well, to encourage the use of iodized salt in processed foods and condiments. So I hope that gives you a little bit of color. If there's any specific things, I think someone's going to talk about Mozambique a bit later, any other specific kind of concepts or ideas on Africa you'd ever want, I'm always available and always happy to assist. I think I'll hand back to Luis to finish off. Thank you very much.
Thank you, Rich. Now, just going to an end, I would like to go and tell you that the process of physical analysis of iodine content in salt is extremely rigorous, following a legal and an administrative process ranging from the collection and segregation of samples of the product exposed at the point of sale to the analysis of the iodine content in the central laboratories with the disclosure of the result. A non-conformity of the product is a sanitary infraction with the determination of the interdiction of injection and suspension of sale of use, and the lot of the product through publication in the official gazette and sometimes in the press. This is an extremely crucial and delicate moment for the producer, because when banning and suspending the sale and use of the product, his brand was exposed to hard press disclosure with a strong commercial and competitive negativeness in the business. Definitive infraction of the sanitary nature that through the gradation of sanctions provided for the law, can determine the cancellation of the registration of the product and the prohibition of the producer's establishment. As a conclusion of how a strategy of high relevance in terms of public health can be implemented through alliances and joint efforts of salt companies, public power, and other partnerships depends on the secure convergence of stakeholders and commitment to better meet the needs and demand of the society. Our salt industry is firmly committed to the national effort to maintain adequate iodine intake through the iodization of salt consumption, supporting public health authorities and advocating for the country's sustained success in the virtual elimination of the iodine disorders. Thank you very much, sir, for your attention. I would like to introduce now Mr. Khan.
Good morning. I'm Noor Khan, Senior Technical Advisor for Nutrition and Food System in the Nutrition International. And I'm giving this presentation on behalf of our colleague Abdulaziz Adish, who is the Deputy Regional Director for Africa for Nutrition International. So this is the structure of my presentation. I'm not going to speak much about the first two bullets because we have learned a lot during the past few days. I would be speaking about the challenges to achieving the last mile because so much successes we have achieved. And then would be talking about the salt industry consolidation, where we stand, and then what is needed to be done. So as I have said that during the last few days we have learned a lot that about the successes and achievements, and to which yes I agree that we have achieved a lot and we have been successful and we should celebrate. However, the nature of IDD, if we see, this is different from other diseases, like if you take typhoid, if you take malaria, TB, and there is a good example of smallpox eradication. You treat the patient, you eradicate the problem, and then you close your shop. But IDD is different because IDD is due to iodine deficiency, and iodine you need continuously, daily, on a sustained manner, in a specific amount for the whole life. So here we need to continue our efforts to sustain the successes that we have achieved. To achieve universal salt iodization, all salt from large, medium, and small scale producer must be iodized and reach over 90% of household at a level required by the human body. However, despite the progress which we have seen that have been made globally, a sizable global population still remains at the risk of IDD. And where there are successful USI programs, they are not sustainable. So yes, we should celebrate successes, but we should work for sustainability, which is a bigger challenge. I would give the examples of Senegal and the Pakistan, which I yesterday presented. Though we have been successful, the household utilization has increased. But what I always say, that the moment you withdraw support, until and unless you have a good system in place, the programs would collapse. So there have been successes, and as Jonathan and his presentation mentioned, 19 countries, they are still iodine deficient. So, in addition to the other challenges, there are a number of challenges, but the biggest challenge is the industry. Not that they are not cooperative, not because that they are not cooperative, but because This is because of the industry structure. So the salt industry has achieved a lot and contributed a lot during the past 3 decades, and the control of IDD through salt iodizations for human and animal consumption. This is a remarkable progress, but as I said, that there is a challenge, among other challenges. One is the salt industry structure. And that is the small scale industry, very small scale industry, which needs consolidation. And many countries face difficulty achieving USI, as many are small scale salt producers. They are scattered. Their salt production is mostly seasonal. They lack quality control systems, and they are often the main source of the unanodized salt in the market. When we look at the magnitude of the small scale producers, there are different regions and different countries have different level of small scale industry. If we look at Asia, in Asia, Pakistan, Indonesia, Philippines, they depend, their population, more than 50% of their population, they depend on salt from the small sector. When we look at Afghanistan, India, Bangladesh, and some other countries, they do have small scale production, not at that extent, but they are still dependent. There is, like Afghanistan is dependent on imports, but some portion is dependent on the local small scale producers. Similarly, India has achieved a lot, but still a sizable portion of population, they depend on the small scale. In Africa, Ghana example was given by Rishi just moments ago. And then Senegal, extremely fragmented, scattered, unorganized, and very small scale industry. There are countries in Africa like Ethiopia. I would give the example of Kenya, where there are few big salt producers, and they don't have much small scale producers. Ethiopia, they have thousands of small scale producers, but now they have some big salt producers, centralization facilities, which would be able to cater to the major portion of the population. So Tanzania, another country where there are more than 7,000 small processors which depend for salt from firewood, boilers for their subsistence. When it comes to the definition, because there is always confusion, what are the large scale and what are the medium scale and what are the small scale producers? When we talk with regard to wheat flour fortification or maize flour fortification, then there is a standard definition. And there when we say that whenever the production of a flour mill is more than 4 metric ton per hour, then we consider that as a large scale. Whenever the production is between 1 to 4 metric ton an hour, then we say that is a medium producer. But small scale is 100 kilogram to 1 metric ton an hour. But with regard to salt industry, different countries, they have their own definition of small scale and medium scale and large scale. Like Tanzania, they say they consider more than 10,000 production a year is a large scale industry. Bangladesh also consider more than 10,000 as a large scale industry. But when it comes to Pakistan, they consider more than 5,000 metric ton production is a large scale. And similarly, with regard to small scale, Tanzania, they say 10 metric ton to less than 1,000 metric ton, they consider that as small scale, while in Bangladesh, less than 4,000 metric ton they consider as small scale. So there is different countries, they have their own definition. So why we say that this is a challenge? I briefly mentioned in my earlier slide also that this is a challenge because these small scale industry producers, they use a very primitive salt production process and technology. When it comes to iodine mixing, they use manual methods of mixing, especially they use knapsack for spraying, which would not give you consistent and uniform mixing and salt. The enforcement of legislation at this level could be difficult and more challenging and weak because of the government capacity and the coordination among different government departments, lack of lab network, quality control, quality assurance, quality control systems. So, and then these processors are often resistant to change because they consider that this would negatively impact their profit margin, which is really very minimum. The large number of small scale makes developing and maintaining a consistent approach to iodization and quality assurance extremely difficult. So this table gives you like the comparison between large scale and small scale, what the differences are. When it comes to the product, a salt, the large producers, they produce more refined product with higher profit margins because this is high quality. When it comes to small scale, they produce raw salt with low profit margin. Iodization and quality control in large scale is high quality and relatively easy for the government to control because mostly the large scale industry is registered with the government, is formal and organized. But when it comes to the small scale, then none are poor iodization and hard to quality control. Marketing, the large scale, they are able to market their salt with a consistent margin, but for the small scale, it is more challenging and it's vulnerable to price fluctuations. Large scale industry, they have a secure income, they have a secure future, but small scale, they depend on the season, depend on the sale of their product, so they are more insecure. And similarly, the cash flow, they have a stable cash flow, the large one, and the small scale, they don't have access to the capital. So, what is the solution for this? The solution for this is that we shouldn't have any small scale industry, which is difficult, which is not possible. So the best is to enhance the viability of the small scale producers. We won't want them to be out of their business. But recent developments, they are emphasizing an approach towards consolidation where small scale processors would produce their salt and sell to a central investor who would then improve its quality, iodize it, and package it in a nice and proper way, and then would market this. Consolidation of industry is a viable option where there are many small producers and has worked in different countries across the world. I would give the example of India, where past couple of years, we had assisted them and under a pool financing mechanism where the medium and small scale producers, they were incentivized to expand their production of adequately iodized salt through increased purchasing of raw salt from small scale processors who would ordinarily produce an unrefined salt. So many more medium salt processors have since followed the example and are now buying up refined salt from small scale processors and refining it. So over the past few years, more than 1 million metric ton of annual production out of a total of 6 million metric ton annual production has been shifted from unrefined to refined salt. This represents a significant consolidation of the industry and will help to ensure that salt is more sustainably iodized. Cambodia is another example where there was in year 2000 the salt iodization was really very low. It was by up to 13% of household consumption, but they were able to make a salt producer association, an arrangement where around 167 salt processors came together and they start iodization. Coupled with this, there was mandatory legislation announcement also, which helped them in improving their iodization. Working of a consolidated industry. Here, like the new business entities formation to consolidate the salt produced by small producers, as I gave the example of Cambodia. And the process would be by to achieve enough economy of scale, the investor purchases the salt centrally at a consistent price and stores in bulk. The same is happening in India with those refined, those big producers who produce refined salt. They improve its quality through further processing such as washing, grinding, and packaging. Alter the role of the current salt processors to focus more on raw salt production, and then they have robust technical management system to determine what is appropriate for the market. A little more about the status of the industry consolidation. China is a good example. They have highly consolidated and controlled salt industry. There are two types of consolidation. One is market-driven through market-owned system and mechanism, and one is supported through the government or pushed through the government in the development sector. So here the main role is of the government and the partners. Senegal also many salt farmers and getting organizing into business interest groups. Pakistan, there is no push, but there is natural marketing forces it's going towards consolidation, but very slowly. India, I gave the example. Ethiopia, Cambodia, Uzbekistan, and many other countries, they are successful towards consolidation. So how consolidation process could be supported? First would be to address the key issues of transportation, how the salt could be transported from the small scale to the large scale. The price difference also, definitely there would be difference in the price, so those should be addressed. And then we need to find an investor, and then ownership in the longer term. For this, last year, a few years ago, IGN and Nutrition International has a mission by IGN to Tanzania. They had done a great work, and they brought together all partners, GAIN, Nutrition International, the government, and they propose a system where there could be a smooth transition towards consolidation. What are the recommended steps? These are also the recommended steps towards salt iodization, which have been proposed as a result of Iodine Global Network mission to Tanzania, 2016 perhaps, right? And here I have mentioned the role of the government and policymaker, but I would say the role of industry is more crucial and more important in going towards consolidation. And I've seen in a number of countries champion in the industry who are striving hard and who are working hard and making progress towards consolidation. So these are basically recommended steps for consolidating the salt industry. Conclusion, I would say that salt iodization is one of the biggest public health successes I have seen during the past few days. And despite this success, challenges remain. And IDD prevention efforts needs to remain a cornerstone of global nutrition agenda. And a consolidated salt industry is a key driver of sustainability. I would again say sustainability, not success. Success without sustainability is no success. So sustainable salt iodization. Thank you very much.
Well, thanks, everyone. We have about 10 minutes to maybe have any questions from the audience. If you have any initial feedback, I just want to sort of summarize what we tried to do this morning. And first of all, to just, again, echo and highlight the fact that we have experienced this tremendously successful public health program through working with the salt industry by iodizing salt, by ensuring mandatory salt iodization. We've had tremendous success across the globe. At the same time, we've recognized that there have been a couple of inputs that have been made that are not necessarily sustainable. With the best of intentions, with the best of aspirations, the development community undertook a tremendous amount of effort with external support, not necessarily building a sustainable salt industry around salt iodization programs. And we've learned from that. It's been humbling, and I think that it's important for us to acknowledge that the original paradigm of focusing on making sure that all household salt sold through retail channels is adequately iodized, whilst was a very important initial step towards achieving salt iodization success in many countries in the 1990s, really doesn't make a whole lot of sense in 2017, 2018, as salt consumption patterns shift and as an increasing proportion of the amount of salt in diets comes through processed foods and condiments. So we have tried to be nimble. We've tried to enable ourselves to understand as saltization programs mature and as salt consumption patterns change, so do salt iodization programs have to evolve and be a little bit more flexible and accommodating. One area is around the salt industry consolidation, as Noor has described. The picture that he showed from Tanzania of women using a very rudimentary boiling technique is widespread. There are over 6,000 of these women who basically produce kilograms of salt that are then sold to local markets. Obviously, it does not lend itself to any processing or any way in which that salt can be effectively iodized or quality controlled. What we'll hear from this in the next session are additional major pushes to make sure that the regulatory monitoring systems are improved, the way in which premixes procured is done more efficiently and effectively. But I think that one of the things that we've done as the Iodine Global Network is to acknowledge that we have been successful, but that as with any major public health program, that we have to be adaptable and flexible moving forward. So with that, let me just open up. There is a microphone if there are any questions to myself or to any of the presenters this morning. Thanks.
As a result of information that's available on the internet, true and false and otherwise, there's a reasonable kickback in populations to compulsory fortifications in food, to vaccination programs, to a whole range of things. How do you think you're going to counter that?
Yeah, it's a good question. You know, we often think that we have this tremendously successful intervention and program. I mean, who couldn't support the idea of adding a small amount of iodine into salt to protect the brains of unborn children? but the amount of pushback that we've gotten a lot from medical associations, but also from consumer groups about altering salt. Why would you want to change the raw sodium chloride product that is harvested from the earth? So communication is super important. What we've learned is that we have to manage our messaging very carefully. We have to be very careful about making sure that what it is that we're promoting in terms of the use of salt as a vehicle for iodization is safe. We are able to call upon the numbers of studies that have demonstrated the safety, that there are no adverse organoleptic changes associated with the use of iodine, and perhaps most importantly, that even if too much iodine is consumed on a transient basis, that doesn't lead to long-term permanent physiological impairment. So, we're struck often by the fact that while we work with the salt industry and we iodize salt and we push this program, we try to make sure the population is provided with adequate supply of iodized salt, that there are certain groups that are very skeptical, very cynical, and somehow have the loudest voices in being able to voice opposition. We found that recently in China, where there was a tremendous concern that iodized salt was actually leading to an increased incidence in thyroid cancer. It actually led to major policy changes and reforms. So the Iodine Global Network with other partners have had to come in and make sure that all of those changes that take place are moderated and try to be cared for. But it is a huge part of the work and the effort. Yeah, follow up.
Just on that, in New Zealand and Australia, some years ago, there was iodized salt added to bread as a compulsory addition. And at the time, the authorities were thinking about adding, I think it was B12 for the neural tube defects. And the iodized salt got through, but the other one didn't. You know, there seems to be a reasonable acceptance still of adding iodine to salt, but perhaps not other things.
Oh, totally. I mean, folic acid has been controversial because of its potential impact on neural tube defects. We've been relatively lucky with iodine because it's a widely accepted nutrient, but there are those who look at potassium iodide and suggest that it may be carcinogenic. We've had to address that. We've had to address the fact that high levels of iodine intake that could be realized through poorly regulated programs could be problematic. But Australia and New Zealand, I mean, your countries, those countries are really important because it was never possible to mandate iodized salt for consumers through imposing that all retail salt would be iodized. So the country moved ahead and made it mandatory to use iodized salt in the bulk of bakeries, so that bread uses iodized salt in its production. And it's transformed country. I mean, Australia was classified as iodine deficiency as recently as 2007, but you've been able to reverse that because of the use of iodized salt in bread. Yeah, no, it's been incredible. So fortunate for that. Any other questions for either myself or Luis? Or yeah, please. Mort.
Thank you. Yes, Jonathan. Just one question. Has any thought been given to branding iodized salt? In other words, having some small logo or something associated with iodized salt, calling it, smart salt or something like that. Investing in the future, investing in your children, making your children competitive in a very competitive world, that sort of thing. In other words, differentiating non-iodized salt from iodized salt and trying to make it very, very simple and very clear why it's being iodized.
Yeah, great question. Yes, and we have to be careful. Yes, in that obviously the role of iodine in improving neurological development and cognition has been a major shift of our focus from thyroid disorder and thyroid disease. Associated with that has been the promotion of the fact that communities consuming iodized salt will have been seen to have dramatic increases in IQ score, up to 12.5 points as compared to communities without adequate iodized salt or any iodized salt. The challenge, Mort, and we've seen this in a few places, is that if you focus on use iodized salt to make your child smart, can be misconstrued and lead to abuse and lead to overuse of salt. So I had an experience, personal experience, where I was in Fiji a number of years ago, where I was talking to a bunch of nurses, public health nurses, about the importance of iodized salt and promote the potential benefits of iodized salt on scholastic performance. And there was a woman in the back of the room who stood up and she said, you know what, last week we were sitting in the same room talking about obesity. And we were talking about, the risks of excessive salt intake. And at that time, a population that is dealing with a very high burden of cardiovascular disease. And there are mothers who are giving their children salt water, iodized salt water, before they go to school so that they can perform well in school. So again, manage the communication. Don't eat more salt necessarily, but the salt that you eat, make sure that it's adequately iodized because it can have profound benefits on your child's development. So yeah, in Indonesia, the main logo for iodized salt is of a child with a little cap and gown, anak pintar, or smart child. So super important to promote that particular benefit of using iodine, improving iodine nutrition, but again, being very careful, as you had said, if we don't manage communication and messaging, people can take things and misinterpret. So we've tried to be very careful and understand, field test a lot of communication strategies to make sure the communication is done well. Any comment from any of you guys about that? No? So I think we may have time. We have about 2.5 more minutes for one more question. Yes, please.
Will the additional iodine to salt differ from country to country? I'm from Norway, and we have less iodine in salt compared to Sweden. And if a new program, will you differ in what you're doing in Africa and India, the amount of iodine added to the salt? And is it a level which is too high and it might cause another problem?
Yeah, Norway's an interesting country. I mean, you have recent data that suggests that iodine deficiency is a problem, and that is because of the fact that your salt is not iodized in most cases, and the government has been reluctant. There's, again, the challenge with iodized salt, unlike other public health interventions, is that we recognize that essentially it's a private sector intervention, and that the cost of iodization needs to somehow be absorbed, either by the industry, by the government, or by consumers. What we've come to appreciate is that the long-term sustainable strategy is for the industry itself to recoup that marginal cost. It's a very small marginal cost, but there is an additional cost to potassium iodate, the fertificant, as well as to the mixing that is required. For the most part, I think that as Nora mentioned earlier, and also Luis did, the earliest saltization programs were very heavily subsidized by donors, by international partners, and the like. And it led to dramatic increases in saltization coverage. And there was a lot of success and a lot of celebration. However, as soon as that support was withdrawn, because the structures, the systems, the procurement of potassium iodate in particular was not in place, it led to a faltering of programs. So I think in principle, the Iodine Global Network, which works on the iodization of salt as its primary target intervention, as well as the Food Fortification Initiative, which aims to support countries in establishing large-scale fortification of maize, rice, wheat, and other cereals, is of the mind that high degrees of subsidization is not appropriate for the long term, except for very, very specific conditions. And that is to subsidize the cost of fortified products through public distribution systems which target impoverished and low-income consumers. One of those lessons that we've learned it the hard way. We've seen programs, seemingly have tremendous achievements and then slide back and falter as a result of that. So we have learned a lot, I think, about the role of subsidization, external support. But again, this is where the salt industry, in a way, a major shortcoming, and I would say a problem of a lot of initial saltization programs was the very heavy driving that was done by the public sector, by governments, by development agencies, and not involving the salt industry. And if we've learned anything, and that is that we have so much to learn from you guys. We have so much to learn from salt producers, from business partners who know how the salt industry operates. Fortification is an addition to that, and again, as we move forward, what we've really tried to do within IGN, within a number of other agencies, is to request assistance of people like Rishi, like Luis, like major salt producers to really help guide us about policy changes. How can we implement these programs in ways that will be most sustainable, effective, but ultimately will be in accordance with the aspirations of profit and revenue requirements of salt producers themselves. So just a comment on that. Thanks. Noor.
Salt consumption patterns also. So it could be different in different countries, and the reason of Sweden using more iodine than Norway could be the consumption of iodine, the consumption of salt in Norwegian population, which could be more than what you have in Sweden. I don't know. Okay.
So with that, Morten, I'm gonna go ahead and break because we're at 15 minutes after the hour. But come back in 15 minutes. We have a great program which will include a panel discussion together with salt producers. So thank you very much.